Hello,
Hello,
I'm Vidya.
and I'm Pradeep.
We are here to talk about our PLAB experience, our journey from India to UK.
And the different steps, what it entails and what it holds for you in the future. Let's start.
The first and foremost important step in your PLAB journey is to get your passport done. So once you have your passport, you are eligible to book an IELTS exam. IELTS exam stands for International English Language Testing System. This is like an international exam which gives you eligibility to take up the next steps. Those are the PLAB tests. So IELTS exam costs you around like 14 to 15,000 rupees, and it's conducted usually twice in a month, and it tests mainly on the 4 categories: your reading, writing, speaking and listening. So each of this category has been rated from 0 to 9. These are called bands, and the minimum requirement would be to take 7 in each of the categories and an overall of 7.5 for you to be eligible to take up your next steps. Also, this exam, there are various coaching materials that you can use, like which I did was IELTS Master. You can also take up, there are various PLAB forums and even Facebook groups which can help you and guide you in this regard. Usually this exam takes around like 2 to 4 weeks of preparation based on your English language proficiency. And this can be taken throughout India. There are various centers where this exams has been conducted. Once this exams is done, you can expect your results to come out within 2 to 3 weeks. Once you are done with your exam, you're happy to go ahead and book your PLAB 1 exams.
Yeah. So there are a few other things to keep in mind when we give the IELTS exam. And the foremost thing is to select your category in which you're giving the exam. There is IELTS Academic and IELTS General. As doctors, we need to take the IELTS Academic, which will be used for your GMC registration. And coming to your experience your experience of the IELTS exam, as my friend just gave a few hints about that, you need about 4 to 5 weeks of adequate preparation, and it's always good to prepare with an academy or a coaching institute, and you have that all over the place in your home country, and we have that in India as well. And in my experience, I took a coaching class for about 4 weeks, and we got the materials supplied by the British Council under which we registered, as well as the materials that was provided by our coaching institute. And so you can book the exam under either IDP or British Council. I think the latest news that I've heard is the IDP has taken over the British Council as well, and you can confirm that with when you're making a booking. And you will be supplied study material from that council, and it will be posted to your home. You can use that material for your preparation as well. Alright. And I was telling about my experience. It was a face-to-face experience. It was a one-on-one experience that we had. It was an online one. That it helped me for writing and speaking, which is it's very vital for this preparation, because listening and reading are quite similar and quite easy for you to grasp and understand. But the speaking and writing entails you to prepare more efficiently, because it's quite difficult for you to get a 7 band in both of them. And the other option, coming to the English language test per se, is other than IELTS, is the OET, that is the Occupational Entrance Test. So this exam can be given by anyone who is again willing to pursue their PLAB exams. It's also recognized by the General Medical Council, and it's a similar kind of exam which tests your listening, reading, speaking and writing, but it's more clinically based and clinical scenario based. So you would have come across the medical case scenarios multiple times in your medical career as a student and as well as an intern. So the similar kind of scenario will be given in all these 4 categories, and it'll be quite helpful if you're good with your subject, and you're not that good with the IELTS exam. You can definitely take the OET exam, and it will help you a lot. So there is a lot of talk about OET and IELTS comparison. So when we compare the exams on a holistic way, the IELTS is a more strict exam, and they want you to score. The bands are quite difficult to get, so you can see people failing more times in IELTS. So hence they will prefer OET, which is a more easier exam to clear. So OET exam is again conducted in many places in India, in many sites. You can find the coaching institute that has been set up nowadays, and again you need a preparation of 4 weeks, and the cost of the exam is around 30,000 or so. It can be more nowadays, and the important thing in OET is you need to score a score of more than 350 in each category and an overall grade of B to pass the exam. So once you're done with either OET or PLAB, OET or IELTS, you can take the next step, that is PLAB.
So if you've cleared through IELTS or OET, well done, congratulations. If not, don't worry, there's always a next chance. And the good news is, for IELTS or OET, there's no maximum attempts that you can give. So keep trying and you'll definitely get there. Next, once you're done with the IELTS, register yourself in the GMC, get your provisional license done. This is very important here, that you give all the information to 100% to the best of your knowledge and be truthful, because all the information here will be verified later date. So once you're registered and you update your IELTS scores, you will be opened up to start booking for your PLAB 1. What's PLAB? PLAB stands for Professional and Linguistic Assessment Board. This is the entrance test through which you can begin your journey to come and work as an NHS doctor. So PLAB 1, once it's conducted year-round, like at least 4 times a year, and now because of COVID there has been a slight changes and there has been a lot more seats that's been opened up. You can actually look through this and you will have a lot of available seats more than 4 times in a year. So what the exam pattern of this? PLAB 1 consists mainly for testing your theoretical knowledge, but this is not based on your factual knowledge. It's the application of the knowledge that you have. So what it means is, PLAB 1 tests for the minimum requirement of the knowledge that you need to work as an F2 doctor in UK. So most of the questions are related to the emergency and regular or the frequent chronic conditions that you see under NHS. These questions are not just based on a local protocol or a guidelines. The answers to these questions are based on thorough research and a well-established plan of treatment. So there are various materials which you can refer for this. There are various online platforms like in Facebooks and Instagrams. Even Telegrams provides you a lot of online materials which you can use for PLAB 1. I personally used PLAB 1 keys as a notes to go through, and I used PLABable as a question bank which I used for PLAB 1. Usually the time duration for PLAB 1 takes around 1 to 2 months. Again, it depends upon how much number of time and the effort that you can put in for this exam. This exam is quite easy and enjoyable one, because you are applying your theoretical knowledge and not just memorizing one. This exam consists of around 180 questions answered over 3 hours, so 1 minute for each question, and have 5 multiple choice questions with just 1 correct answer. And the best part is, doesn't have any negative marking. But the thing is, each exam, the cutoff score for pass or fail is determined by the collective score of each individuals who take the exam on the same day. So there's no fixed cutoff, it keeps varying from exam to exam. So once you're done with the PLAB 1, your next step is to book your PLAB 2. But if you're not successful, there's still a good news for you. You can give another attempt. But PLAB 1 restricts your number of attempts. You can take up only 4 attempts, and once you're not successful for the fourth time, you still have a last ray of hope where you can actually show your improved knowledge or learning through GMC, and you can actually give one final attempt.
So now that you've given your PLAB 1 exam, you need to wait for the results, and it's usually going to take you 4 weeks. And within 4 weeks, you have a couple of important things to set out, all right, and keep it ready so that you can sort it out later. The first thing is, after you've given your PLAB 1 exam, relax. Don't worry about the next steps, because it's going to be a very slow and it's going to be a challenging one. It's going to be ahead. But right now what you need to do is get adequate rest, enjoy yourself, and then make sure you get your EPIC verification done. So EPIC verification is similar to the ECFMG verification that is done for international medical graduates, all right? And it basically verifies your primary medical qualification as a doctor in your country, and you need to get that done once you're waiting for your PLAB 1 result. Because for your GMC registration, they require your EPIC verification along with your PLAB 2 clearance result. So it's always good to get it done when you're free. Now, so now that you've given your PLAB 1 exam and you're waiting for your result, you're gonna get your EPIC verified. Good thing. And now once you're cleared, congratulations. Welcome to the next step. Is going to be a big one. All right. So once you're cleared your PLAB 1 exam, the most important thing you need to do now is sit down, take your notepad or your pen and paper, and you need to make a huge list, because the journey is going to be a challenging one. So now you need to come to the UK to give your next exam, which is the PLAB 2, and a bit about PLAB 2 exam. So the PLAB 2 exam is going to be an OSCE, which is OSCE stands for Objective Structured Clinical Exam. So it's basically a clinical scenario which will have an objective that you need to fulfill. So the exam consists of 18 stations ideally. Due to COVID, the number of stations have been reduced currently. However, the ideal situation will have 18 clinical stations and 2 rest stations in between. All right, and each station will last for 8 minutes. Once the bell rings, you'll have 1.5 minutes to read the question which is outside the room. So you need to prepare and plan out your way of approach to the case, the scenario there, within 1.5 minutes. And then when the bell rings again, you need to enter the room. So you have 8 minutes to fulfill the task. So there will be an examiner ideally in the room who will be observing you, and he will not be making any other gestures or any other any contacts, or he doesn't have anything to do with the case scenario that's happening between you and the patient or the simulator. He's just going to be there and observe you. Okay, so within the 8 minutes time frame, you will have a patient or you will be having a simulator or a person who will be enacting as the patient with a particular condition. You need to take the history. It will be judged on 3 things, that is the clinical examination, the history taking, and the management and the interpersonal skills. So the clinical examination and the history taking comes under, both will be counted for 4 marks. The management will be for 4 marks, and the interpersonal skills will be for 4 marks. So each station will be graded for 12 marks. Okay, and you need to clear a majority of 11 to 12 stations to clear your overall exam. For your PLAB 2 exam, you need to take a coaching again. You need to subscribe to one of the coaching centers. There are many in UK, and it's going to be a clinical based, and it's going to be a clinical based center that will be based in the UK. The exam is conducted in Manchester, so you need to give your PLAB 2 exam only and only in Manchester. There are academies like Swami's. There are coaching institutes like Aspire, Common Stations, Samson's. So you get the materials which they will provide you as a printout or a copy of online material, and pre-recorded videos as well, depending on what the coaching institutes are providing for their students. So ideally you need 4 to 6 weeks of adequate preparation to pass this exam. It is a bit challenging exam because you need to put in your medical knowledge, which was tested earlier in your PLAB 1 exam, and use that in your clinical scenario, it's going to be a bit more challenging, as they test your personality as a whole and not just for your medical knowledge. They're going to check how you decide a clinical based scenario and how you enact in that situation being a doctor. They check your personality, they check how empathetic and sympathetic doctor you are in that case, because from where we come back home from India, the scenario is completely different. The way we see patients is completely different. So that's one of the key things that we need to keep in mind in the PLAB exam. We're going to be talking in detail about. It's going to be a different video because it's going to be a very elaborate journey that you'll be having. You're in a completely different land, a completely different culture. You're new here. You don't have much friends. You'll come all alone, and it's a do or die thing that you need to. Because you've given it all. You've spent a lot of money for the travel and the exam. The cost of the exam is also not that cheap. It's a bit expensive. It's about 80 to 90,000 in Indian rupees, or 800 pounds in British currency. So again, you're going to be spending a lot of money to come here. So it's always good to keep that in mind. You're going to give your best shot when you give your PLAB 2 exam.
Really, in my experience, the most challenging thing for me was PLAB 2 exam. It's especially not because of the exam per se, but because I had to relocate from my own country to this land. To be honest, this was my first international flight. I've never left my country, so I was really scared, and because of COVID, all my friends, we couldn't book the exams together, so I had to fly alone and make all the arrangement in this foreign land all alone. I understand it is very challenging, but was a very good learning experience. It's made me more stronger, bolder, and more confident, even though I'm in a foreign land. And the best part of all this exam is we do have a lot of knowledge about this exam. The theoretical aspects of it are well covered in PLAB 1. But the challenging aspect for us is the communication. Because in my experience, I was not very comfortable with English as being fluent and being expressive in this language. But the exam expects you to be more sympathetic and considerate, passionate doctor. That's the main thing that they're checking in this exam, not the theoretical knowledge which has already been assessed by PLAB 1. And they also examine your clinical skills, examples like IV cannulas, your blood gases, and these are to be done on mannequins. So this can be a bit of a challenge because the patient is acting. Those are the simulators, they're not real life patients. So there might be a slight confusions. But with adequate practice and attending the academies, practicing thoroughly with your peers will actually make this journey a very pleasant and an enjoyable experience. So once you're done with the PLAB 2, your results again you have to wait for say around 2 to 4 weeks depending upon the load of the students they're taking the exams. So once you're done with the PLAB 2, well done. Most of the journey as PLAB is done, but you're beginning a new journey in the UK. So once you're done with the PLAB 2, the next step is to get your GMC registration done. So for the GMC, as we previously spoke about, you need your EPIC verification and the PLAB 2 completion. So once you're done with your GMC, you are eligible to work in the UK. So there are various options for you to work in the UK. You can apply through NHS jobs and track jobs, and it's an elaborate process. So all along in this journey, you need a lot of patience, time, and persistence.
So this is just an overview of how we thought the PLAB journey is and how we have experienced it so far. However,
we're looking forward to make new videos and try to contact you guys, probably a live session on one-on-one.
Yeah, and this is only as I said, it's just an overview. There's lots of things to consider in each step of the way, and it can be quite challenging. You need a lot of guidance from your seniors, your friends, your family. It's always good to keep in touch with all your seniors who are already in your care, and we'll be glad to help you if you have any doubts. And please contact us if through the live sessions that we're going to come up in future with. And hope this video will give you some insight into this journey. And
hope to see you guys soon.
That's it.